So, welcome to this episode of Menopause Conversations. I'm absolutely delighted to have my next guest. It's a bit of a pinch me moment. I did just say that to Liz before. I woke up a bit giddy this morning, but we are absolutely honoured to have the amazing Dr. Liz O'Riordan to Menopause Conversations today. Liz is a former consultant breast surgeon turned patient advocate, but I'm not going to say too much more about that because I would love for her to introduce herself because I think this is such an important topic. So over to you, Liz. Tell us a little bit about
Oh,
yourself.
thank you. It's a really crazy story for those who don't know me. I was a breast surgeon. I was 40. I thought I had my life sorted. And then I got breast cancer. Never checked my breasts. I just saw a lump coming out the shower one day. And 2 weeks later, I was having chemotherapy. And I had every single treatment I recommended to my patients. And I had a local recurrence on my chest wall a couple of years later in 2018. And then it came back again locally in 2023. And it meant that I lost my job, I lost my purpose, my identity, my career, my fertility. And I've somehow learned to rebuild myself so I can carry on helping people in other ways. And I guess that's why we're here today.
Wow, that's phenomenal. I mean, there aren't many instances where one person gets to experience both sides effectively of that table, do
Yeah.
they? And I would imagine that has been an incredibly dramatic, humbling, lots of adjectives probably that certainly wouldn't stand up to actually the experience. But I would imagine that has been a really interesting journey for you, and it's one that makes you a much sought after speaker because actually I think connecting those dots for people is really powerful. I mean, on that point, if you were to encapsulate your biggest learning, what what would you say your biggest learning has been to date? Would you say,
Oh,
looking across
wow.
both sides of that table, is there
Yeah.
anything?
No, it's funny. I've just done a video for YouTube with the 25 things I've learned that I wished I knew before I started. There's so much. I
Yeah.
think for me, I thought I would know everything there is to know about breast cancer. I'd been an expert in, I had a postgrad degree in it. But the minute you are on the other side and you find out it's cancer, you are just a terrified, vulnerable woman in a sterile clinic room. And you realize you don't know what it's like to have chemotherapy and you don't know what it's like to decide whether to have your breast reconstructed. And for me, the hardest lesson I learned was that the scariest bit is when the doctor says, right, you finished active treatment. I'll see you in a year or 5 years. Off you go and live your life. And that's when you're left thinking, yeah, but is it going to come back? And what do I do? And how do I cope with the side effects? And I don't know how to navigate this new world and the mental health changes and all that kind of dealing with the consequences of breast cancer, not just for me, but for my family and my friends, was huge.
Yeah. Can you tell us a little bit about that? Because I think so many things happen to people during that time. Like you sort of say, because it wasn't just your cancer diagnosis. Obviously, this is a podcast about menopause. Obviously,
Yeah.
women are and people are plunged into hormonal situations they probably didn't envisage would happen alongside cancer. Could you share a little bit for us about the impact
Yeah.
then of that with you and your family and your friends? Because I think that's really powerful.
Yeah. Of the menopause. Yeah.
Yeah.
So my memories of the menopause were my mum, who would have hot flushes, and I now know why she went to the supermarket every day to open the freezer aisle to cool down. But it wasn't
That's so
really talked
interesting.
about, and I had very few lectures at medical school that I paid attention to because I was going to be a surgeon. And I didn't realize that chemo would put me into an instant menopause because the drugs switch off your ovaries. And I knew that because it was going to make me infertile. I was 40, but I was having my second chemo session. So it was 3 weeks in. And I remember that night, I woke up thinking I'd wet myself because I felt a trickle of water running through down my bum cheek and my inner thigh. I thought, oh my God, I've wet the bed. No, I haven't. It's a night sweat. Okay.
Wow.
And on the hour, every hour through the night, that whole dripping in sweat, duvet off, duvet on, huffing and puffing and trying to get comfortable. And that was really hard for me and my husband. Separate duvets were a godsend. And I had these icy cold pillows I could put on. And I learned just to stop faffing and just lie there because you know it will go. But then you're shivering when the sweat dries. So in bed, that changed. My husband and I like to spoon, but it's like you've got 2 minutes before I get hot and I push you away. That intimacy in bed, just that cuddling has gone. And the sweat stains on the mattress and the pillows, that was like, oh my God, this is horrible. During chemo, I described it. There were two, it kind of changed depending on the drugs. I described it as a reverse orgasm because you can feel it coming and it's building from the toes and it's coming all the way up, but you don't really want it. And the guy behind me started laughing. But it is this, oh my God, oh my God, oh my God, here we go again.
Yeah.
But it's instant. So then I was on tamoxifen, which again gave me another kick. Then when it came back, I had my ovaries removed, which was another kick. And I'm now on a drug. I get injections in my bum to keep me never producing estrogen. And it's just like this 10 years of constant, instant dealing with the menopause. There's no slow, is this happening or is this not? It's like bam. You are an irritable banshee. And is this menopause brain or is this chemo brain? What's going on? And my husband was incredible, but he has to put up with a lot. The lack of intimacy in bed, me going crazy, the stripping off. I'm too hot, I'm too cold. We can go on to talk about how it affects your sex life because estrogen is
Yes.
a natural lubricant, so your vagina
Yes.
is dry. You have no sex hormones. Our menopause is worse than a woman going through it normally because at least she has a little bit of estrogen. I have none. It's a dry, barren tube of sandpaper down there. And you're newly married, sex is an important part of your life, and suddenly it's like, ow, oh, okay, how do we get out of this and what do we do? And it was just, I never told patients what to expect because I never knew, because I never listened to the
No.
GPs dealing with it, and I never had training. And I thought, oh my God, I've not been helping anybody.
And isn't this a call to action? Just hearing you speak that, we need people in the National Health Service, we need surgeons, people dealing with cancer to know actually what is the fallout, what are the
Yeah,
repercussions of, obviously in an effort to save somebody's life, actually. No medicine is without risk. No procedures are, but actually, we need to help people be informed, don't we?
yeah.
Because I
And
think
I
we almost think that we treat the cancer, that's it. It's like, no, that isn't it.
No, and I think one of the problems is it's time. I would get 10 minutes per appointment, and I
Of
would sometimes
course.
need 40 or 50 minutes. And I think it's not my job to tell people how to cope with the menopause. I'm the surgeon. You
Yeah.
assume that the breast care nurse or the GP is doing it, but I never checked to see if they were telling my patients what they needed to know. I told them the side effects, but you don't want to go crazy because some people sail through, and often all you hear
Yes.
online is like TripAdvisor, the really bad, and oh my God, a celebrity is suffering, so it's going to be terrible for me. We don't hear that people say, yeah, it's a bit shit for a few years, then it was fine. We don't get that general
No.
average thing. But I think it's making sure that someone in the team is telling that patient, this is how you cope with the side effects, that the GP knows what drugs to prescribe, and that patients know they can ask for help and they don't need to suffer in silence.
I think I'd like to give you a new role within the NHS and to be an advisor. Where's Wes Streeting? I know you know
Oh, I've had
him.
a chat
Um,
with him. He's
I
lovely.
know,
I
I
think
know.
it's
I think you'd be brilliant with regards to women's health and particularly the menopause because I think it's that patient centricity, isn't
it
it? That
is.
that we
Yeah.
absolutely need. And
And
sorry.
I think the cancer menopause gets tucked away. The
Yeah.
women in their 20s, 30s, 40s going through it. And there is so much misinformation is the wrong word. There is a very split divide between people giving menopause information out there. There are
Mm.
people who believe and follow the NHS, the guidelines. There are those who have a very different view of opinion. There's a lot of scaremongering. So there's a lot in the news the last couple of years that HRT will stop you getting dementia and stop you getting heart disease. And if you've got a cancer sensitive to estrogen, and we'll talk about this, HRT is not recommended. But I've had thousands of women crying to me saying, I'm terrified I'm going to get dementia because I
Mm.
can't have HRT. And it is HRT is only licensed to help with the symptoms of menopause. It's not licensed to prevent you getting anything else. But this hits the media, and suddenly we are terrifying thousands of women. And the ripple effect of this general bit of information that trickles down is really dangerous.
It's really dangerous, and it's a cry for more research, basically, isn't it? Unless we've got the research, we're just sort of, we can't go on the fact that 10 people tried it and they all feel benefit. That's not randomized, controlled, placebo,
No.
blinded. It's not robust enough, but we do need more investment in that research. You're absolutely right. So I suppose a couple of things that you said there, which I really love to explore with you, which is actually how can you then manage symptoms without hormone replacement
Yeah.
therapy. Is there anything you can tell us or anything you've tried yourself?
Yeah, lots. So first, I might explain why we don't recommend HRT. So
Yes, please.
70% of breast cancers have an abundance of receptors that love estrogen. Every breast cell has them, but most breast cancers have loads, and that means that estrogen stimulates them to carry on growing. We treat breast cancer by removing it, but we assume there are cells left behind in the body that are just hungry for estrogen. So we give you drugs and treatments to either stop you producing it or stop it attaching to breast cancer cells. That means that they're not stimulated to grow. That's why we give people things like tamoxifen and anastrozole and letrozole. If your cancer is triple negative or estrogen negative, it means that your breast cancer cells don't have any receptors, so that they don't care about estrogen. But if, God forbid, someone's breast cancer came back and it was triple negative, cancer cells are sneaky and they can mutate. So a
Ooh.
triple negative breast cancer could come back with estrogen sensitivity. So the risk is lower for triple negative, but I'm talking about cancers like me who are sensitive to estrogen. We do not have, I'm gonna go into the HRT thing first because I'm here, and then we'll go back to what you can do outside because it
Oh
just
yes,
feels,
you
is that
you
all
you
right?
lead you
Yeah, I'm
lead the
on a roll. Is that all
conversation. You're
right?
the expert for sure.
So there is not good data to show whether HRT is safe after estrogen sensitive breast cancer. Trials done 20, 30 years ago that weren't great. We do have two trials that I believe, others don't, that showed that giving HRT to women with estrogen sensitive breast cancer increases the risk of recurrence. And if your cancer comes back as stage 4 disease, it's incurable, it's treatable, but you will die of that cancer. And in my mind, I'm giving you drugs to stop you producing estrogen to then have extra estrogen increases the risk of recurrence. And breast cancer can come back in 2 months, it can come back in 20 years' time. That's why it is a last resort. So, what do you do with the symptoms of the menopause? Well, I think the two biggest things people struggle with are we call them vasomotor symptoms, the hot flushes and the night sweats. And you start right back at the beginning with lifestyle measures, which actually do work. So it's exercise and it's eating a healthy diet and dietary triggers. So I don't drink a lot of alcohol. I don't drink spicy food because it's never worth it. I'll be dripping in sweat. Caffeine can make some people really bad. Trying to get a good night's sleep. If you exercise and you're really tired, you'll often sleep through the hot flashes and it does decrease them. And they're things that you can do for free that don't involve taking any of the drugs because I'm swallowing loads at the minute.
Yes.
Then we know there are complementary therapies. So things like hypnotherapy and aromatherapy and acupuncture can help, and a lot of cancer centers offer those for free. We also know that something called talking therapy or cognitive behavioral therapy can help, which sounds crazy, but actually getting you to realize this is just the menopause and it's a flush. And instead of panicking, I deal with it and it gives you tools and tricks can actually help a lot because you can't stop them. Everyone has to go through the menopause at some time, and yours may have been 10 years, it may have been two, we don't know. So, kind of learning to accept and deal with it. Then there are alternative drugs. Now, I didn't find out about these until I was 2 or 3 years in, when a wonderful oncologist sent me a tweet and said, Liz, did you know? How did I not know this? There are lots of drugs that are given for one thing, like for pain control or for epilepsy or for urinary incontinence, that also work by reducing the number of hot flashes and night sweats. The problem is when women are given them without explanation, they think the doctor thinks I'm crazy. He's giving me an
Yes.
antidepressant. I'm not mad, I have a hot flush. But they have dual purpose. So I have tried citalopram. I'm now on venlafaxine. I've tried clonidine, which is a heart drug.
Hmm?
Oxybutynin is another really good drug for urinary incontinence that actually works really, really well. Safe to have, don't increase the risk of recurrence, and can also help with the depression and anxiety of breast cancer. And they are great. There is something completely separate to this, which is vaginal estrogen.
Yes.
Now, when I was a surgeon, I would never, ever, ever consider giving any woman it because I am so scared of a recurrence. And I was wrong. But you've treated women who've died of this disease, and no, no, they can't have anything. I
No.
am the god, which
Yes.
is bollocks. Because you can go and buy alcohol, which is a carcinogen. You can go and smoke and get lung cancer.
Exactly.
And I'm like, no. We now know it is safe, meaning it does not increase the risk of recurrence to have vaginal estrogen, whether you are taking tamoxifen or anastrozole or letrozole. The dose we have now is less than a half of what it was when the trials were done. It is tiny. It is safe. I think every woman put on a hormone blocker should be told you can have this because what it does, I know I'm talking a lot here, it
No,
helps
brilliant,
lubricate the
brilliant that
vagina.
you are. It's so great. Please keep going.
It it lubricates the vagina so it's less dry, but it also stops the cystitis, the pain when you're cycling in the saddle, the awful stinging water infections, as well as making sex easier. So vaginal estrogen is completely safe.
Yes, and
But
can I just
the
say, and there are so many
yeah.
varieties, aren't there? You know, there's creams, there's pessaries, there's rings like donut
Yeah,
rings that
yeah,
can then pop up. There's something there for everyone, quite literally, isn't
there
there?
is. And if you're listening and it's worth, just tell your GP. Now, a lot of GPs like me are scared. And I've had patients who've gone to the GP, to the surgeon, to the gynecologist, to the oncologist. Everyone's saying, no, 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 no. The data is there. It is safe. And we can put a link to the notes in this. It does not
Yes,
increase the risk
please.
of recurrence. But also, it should be you as the patient saying, it is my body and it is my choice.
Mm.
I am willing to accept that you think there's a tiny, tiny, tiny increased risk of recurrence if I have vaginal estrogen. But we know that anecdotally, over half of women don't take the tamoxifen regularly because of the side effects. And we also know that if I exercise 5 times a week, it will reduce my risk of recurrence by up to 30%, which is far more than any tiny increase of vaginal estrogen. But it should be my choice to accept that risk, not the doctor to say, no, you can't have it. Because as I said, you could go and buy cigarettes.
Yes,
So I think it's you saying this is it is a so it's like a power share. It is my
yes.
body and I choose what I have, and you shouldn't be the one withholding this from me.
No, and that's the bit I mean about. I think we need to get you into medical schools, back into medical schools as an ambassador about, actually because it's so powerful. I used to work in the pharmaceutical industry, Liz, so
Yeah.
I used to sell HRT around the time of the Women's Health Initiative study,
Hmm.
and I can remember my nasal HRT that I was selling at the time was pulled overnight, and so. We know very much that, these headlines still perpetuate today in 2025, and
Yeah.
we've got medical practitioners out there who are still scared, who are very nervous. To abstain is easier often because they
Yeah.
just don't know what they don't know. So someone like yourself, I think, is so powerful. Please write, please see if there's some more that you could do about that, because I know many of the medical colleagues that we talk about, didn't have the opportunity to learn about this stuff, so they're doing the best case scenario that they can do, but women are still suffering.
Yeah.
Even, and what we know is that even though women might be taking systemic HRT, actually they might still be struggling with, genitourinary syndrome of menopause. And we know
Yeah.
that so many of these powerful drugs and chemicals that we're using to fight cancer are, like you say, very, very drying. I have a colleague called Dr. Alison Macbeth, who we've had
Oh,
on the
yes.
podcast also. Alison is a vocal advocate like yourself that we need to do more. And I love what you've said there about that duality of certain medications. I think that's hopeful for us, and let's hope that there is more research. But I guess also the other thing, I touched on it before, but would it be okay to talk about the impact of cancer on family members, on friends? Because
Yeah.
I have some friends going through that journey right now, and I think sometimes, as a friend supporting or a family member, it can be absolutely terrifying. And I did hear a Radio 2 interview many, many years ago that said an alarming percentage of people who actually just withdraw from friendships
Yeah.
because they don't know how to handle it. Do you have any, I'm sure you do, some
Yes.
advice you can give us about this?
Yeah, so I kind of covered this in my TED talk. That sounds really standoff. I don't mean to boasting. I don't mean to, but I
Not
did
at
a
all. Let's
TEDx.
let's make sure people can go and watch that TED Talk.
I I
Definitely.
I did a TEDx talk in Stuttgart about 9 months after I'd finished treatment, just talking about how to help someone who's got cancer because you
Yeah.
don't know. And I think that's the thing, we don't talk about it. And if no one in your group of friends has had it before, you don't know what to say. It's not a common experience, like, oh, hangover, or someone's dumped you. I know what to do with that. But
Yeah.
cancer, oh my goodness, I don't understand. I'm scared.
Mm.
And cancer patients get upset because people say the wrong thing that hurts them. Oh, you look great, or pull your socks up, or it could be worse. And I've learned that I'd rather people say something than nothing, and they didn't mean to hurt me. It's okay. And maybe I can say, actually, that's really offensive. Just say this instead.
Yes.
There's two things, that there's the ghosting and there's what to help. So I do with the ghosting. I think a lot of people find it really hard to know what to say. And they either have their own problems, so they can't cope with yours, or they're just scared of you dying, and then time passes and it's too late. And I've had really close friends just fade out of my life. But I've
Oh.
had people, so I've got a Barbie doll here. A friend I did when in the sixth form, she used to play the piano for my flute exam. She was incredible. She saw on Twitter that I had breast cancer and she sent me this doll with a knitted Wonder Woman outfit. I haven't spoken to her, but suddenly she came out of the woodwork and was a friend. And
Oh.
I think as an adult, you go through various traumas and people come in and out of your life when you need them. And cancer is the same. And it's okay if those friends aren't there for you. They're not the people you need, and try not to get hung up on it. But what
No.
can you do to help? Firstly, ask the person. So I don't know what you need and I don't want to do the wrong thing. How can I help? And I may say, I don't know, I've never had cancer before, but it could be. I'm going to just say, you're talking to me. I'm going to treat you like Liz. I'm going to carry on talking about adolescence and whatever's on TV and films and all the gossip. But when you want to talk about cancer, you just say, today's an elephant day. And I'm there for you. And I know you just want me to sit and listen. Because all
Brilliant.
people did was talk about cancer, book clubs, how's the cancer? And it's like, oh, I'm not cancer. I'm not just a cancer patient. It's actually saying, what do you want from me? Is today I'm fine, let's carry on day, or is it today actually I'm not fine? Because
Yes.
everyone asks you how you are, and you don't have, it's like, do you really want to know? Do you really want me to break down and cry? Or we don't have time, I'll just say it's fine and move on. So giving people those opportunities. The next thing I said, so my uncle, he's a lovely man, quite a simple soul, all the way up in Scotland. I'm in Suffolk. He sent me a card every Friday for 2 years. And then again when my cancer came back, just
Mm.
telling me about the birds in the garden and what was going on in his life.
Wow.
It's so nice getting something through the post that's not a bill.
Yes.
And there's no, you don't need to reply. And I'd have friends just send me text messages, and I do it now. I have alarms on my phone to remind me so I don't forget them.
Of
Just
course.
checking in. Because
Yes.
sometimes you don't have the energy to reply, but just knowing someone's thinking of you.
Yes.
And I didn't know that I needed a sheet fairy during chemo to come and change the sheets. And I was too embarrassed to ask people. So I'm just going to turn up and change the sheets. I'm just going to turn up and do this. I'm going to take the kids out. I'm going to walk the dog. I can be helpful. Um, you've just got to have those difficult conversations and just ask that person what they need. You may say the wrong thing, but it's better than saying nothing. But I think for families, so my husband, because it's just me and my husband,
Yeah.
um, he's a surgeon, and he said he felt impotent when he went to work, leaving me on the sofa coping with chemo. Because as a doctor and as a best friend and as a husband, he couldn't make me better. And it was all about me. It was like Christmas for a year, all the cards and flowers, but actually, he's going through it and he can't
Yes.
help and he feels stuck. So I would make sure he had people to talk to. And I was pushing him away. Go and marry a woman with two breasts and healthy libido. You didn't deserve this. You didn't sign up for this in the marriage vows. You don't need me. It's like, no, but I love you. I want to let you in. And it can drive a wedge. And
Yes.
it's communicating, it's talking. So my husband believed that he would die before me. And I kind of had a feeling that I'd die first because my cancer was bad. And it was only when it came back the first time, I said, look, can we just talk about this? You need to accept, as horrible as it is, that my cancer's come back and I could be dead in 2 or 3 years. And I know that's a horrible thought, but can we just do our wills and our death admin and get that done and just deal with the elephant in the room? And then you can pretend and hope it's never going to happen. Because they say you'll be fine because they can't bear the thought that you won't be. But I know I might not be fine. And if I'm not, I'm
Yes.
going to resent you for saying I'm fine. It's communication.
Yeah.
And it's just trying to talk about these issues and just find a way to get through them together because they
Yes.
feel left out. He thought I was having an affair because I was tweeting at 3 o'clock in the morning with someone else going through chemo on steroid insomnia. They feel left out because they cannot share that with you.
That's
And
so
it's how you
powerful,
let them
Liz.
in. But it's true. I'm on the outside. It's like your husband feels jealous when you're doing all the bridal stuff and the dressing and the shopping. And I want to play. You can't. You're not
Yeah.
allowed to see me until the big
Yes.
day. Um,
Yes.
but this is like a permanent. I don't know what it's like. And as a cancer patient, I don't want to moan every day about my sore, painful, blistered tongue or the chronic pain I have with a lack of energy because I'm a miserable person to live with. But you want them to know, but they need you to get back. And it's not normal. They need you to move forward and get on with being whoever you are now because
Yes.
they've put their life on hold. And you're like, no, but hang on. And it's a therapy. I'm having therapy at the moment and I feel
Yes.
guilty for having it, partly to deal with the grief of both my parents. But for me, it's having someone anonymous I can dump my shit on.
Yes.
And I don't worry about how they feel when they leave the room. I'm not because as a doctor, I think I can't tell my husband how I feel because then I think, oh my God, I've broken you. I
Yes.
can talk to the therapist, and then when I'm a much nicer person going back to my husband because I've worked through those issues and I can now see them from his side of the table. What he's
Yes.
thinking, and you might need to think
Yes.
it's not all about you.
Yeah.
Um, it's hard, and
Oh,
relationships break up and families split because we don't know how to talk.
and then maybe that's the problem before any of this shows up, isn't it? That actually,
Yeah.
that actually is it a nod to better communication, because we see this a lot in our menopause sessions that we do in workplaces, Liz. We see men very emotional. We see partners in same-sex couples incredibly emotional, young
Yeah,
people who are supporting their parents, who are worried for their parents' mental health. I am a great believer in allyship, whether that's in a intimate relationship, in a professional relationship. We go so much further if we go together type thing. And I love listening to Eckhart Tolle. And Eckhart Tolle sort of talks about, if you want to see like egos at play, it's when families get together. And I think at
yeah,
layer over that, life challenges such as health, financial, kids leaving home, all of these sorts of things. I think that's when we see the quality of our communication truly. So the fact that
yeah,
you are journeying together, and I like that metaphor of the table, because it almost, what I visualized when you said that is, rather than being on either side of the table, it's like coming to the top of the table together.
yeah,
And I think, and there are two ends of a table, so it's lovely. You can invite each other to each other's end of that table, and I think that's really, really powerful. When I was reading your website yesterday, which, by the way, everybody, you absolutely must go and take a look at. It's a joyful, colourful place to be, and I think we need that, because there's aspiration and hope in there. But you do talk about these things, and there's a really nice pictorial timestamp of your experience, and you're very, very open book, I would say. You are so transparent with your emotions. I remember you putting a post at, I think it was just after Christmas, Liz, and I just felt every bit of your emotion. Obviously, you were being vulnerable and saying that you were struggling. You were talking about your parents, you were talking about your situation, pictures of your tongue. And I think actually we need more of that, because
yeah,
we do need to step into it, not step away. And I love the way that you described doing that with your husband. And yes, therapy absolutely is a
yeah,
safe psychological space for you to, like you say, dump your shit, um, come back,
yeah.
build yourself back up, and ready to go again type thing. So I applaud you for sharing that.
Thank you. And I want this one thing I said, you talk about being vulnerable. I'm very aware that I can come across as a superwoman on social media. She's run marathons and triathlons and booked and talked, and oh my God, she's incredible and she's coping with all of this. And I'm struggling to get out of bed. And you kind of realize that you have to show the low moments so people can
Yeah.
connect. And I talk about this with junior doctors and resilience. As a consult, I never saw my bosses cry over a patient who died on the table or a complaint or being sued, because we're trained. I call it internal brown trousers, external calm. You don't show emotion, it's a sign of weakness. But actually, we need to let our juniors in, and we need to let them know that we are struggling and we are human. We are not superheroes. And I think by being raw and vulnerable, you help people realize actually what it's like.
Mm.
And they're the most popular posts. Like, my mum thought I shared too much, but I just think for me it's kind of like therapy in a way. And part of it is shallow. And yes, tell me I'm sad and there and everyone loves me. Thank you very much. But just by showing the reality of it, the good
Yes.
and the bad, people know they're not alone and they can realize that this is attainable.
Yes, because I agree with you wholeheartedly, because we have a problem with the whole menopause topic, in that people think once you reach menopause you're done. And I'm here to tell you, you've got probably another 35 years in postmenopause, and for many it's a smoother experience than perimenopause, but for many it isn't. I was perimenopausal for 16 years, Liz. I became perimenopausal 18 months after having my daughter, and I stayed in that that
Gosh,
that phase for 16 years, raising a child. It was incredibly hard. And like you say about relationships, my husband absolutely was my rock, my bookend, someone who, just no matter how horrid I became, was not going to be leaving me. And that in itself is incredibly powerful. So I feel grateful in the way that you do, and lucky, I do use the word lucky, but lucky that, I had a life partner that was willing to stick around. But I suppose the reality is, we need to educate people. What I'm hearing throughout my conversation with you today is, the more informed we can help people to be,
yeah,
maybe the more collaborative those decision making processes
yeah.
can
But
be. Yes.
sorry, I think you can be too informed.
Oh, okay,
So
so
I-
share
it,
that. So
it's
share that with
it,
us.
it's where you get your information. So I used to tell people don't Google, which is bollocks because it's the first thing I did. But you can go on Google and you can go down scary metastatic cancer blogs and people who
Okay.
had the worst experience. It's a TripAdvisor thing.
Yeah.
Most people talking online have very, very bad experiences that they are talking about. And you can feel that the only people going through the menopause are having a really, really, really tough time. And then you're scared that it's going to be really, really, really tough for you. Because as I said, the people who are just going through it, who are fine, which could be you, can't be asked to talk about it on Instagram because it's not
No,
exciting.
no.
And we don't see that portrayed as, oh my God, the menopause is hell. And while it is for some people, for many it's not. And I think you go down that rabbit hole of it's going to be hell, it's going to be hell. Oh my God, this is awful. And you can get really, really scared. Everyone's experience is unique. And I think you need to know that actually for some people it's absolutely fine. Otherwise,
Yes,
it just becomes this big scary thing that's perpetuated. And I think we need that. It's like informed consent.
yes.
If I'm telling you about something, I have to say the good, the bad, the pros, the cons, what might happen. Let's see where you are. Most of the stuff in the media isn't informed consent, is this is all the bad. Spend all this. I mean, menopause hair and chocolate. It's like the latest cash
Well, it's
cow.
clickbait, isn't it?
You
It's
know, it
it's just
is. But
it's
it's
clickbait.
that the menopause is bad. You should be on HRT until you're 90. HRT is the drug and everyone should be. And it's like, well, no, no, you don't need to be on it. And I think it's just guiding people to get the right information so they can make the right decision for them based on what doctors say, not what celebrities say.
I think that's such a valid point. Thank you for making it because you're absolutely right. And navigating all of that when you just want to feel okay. We talk about the financial hardship that women find themselves in because they're trying, don't get me started on things like a pink tick or a menopause aisle. We just don't need that actually. It's so patronizing. We don't actually need that, but it probably leads us nicely in to talk about your book, which is behind you, The Cancer Roadmap. So tell it, because actually I think that's ultimately what we're all looking for. I think the human psyche is we just want to fix things and the quicker the better. But tell us about the inspiration behind The Cancer Roadmap, because it's not your first book. We must also say
No.
that you have Under the Knife and The Complete Guide to Breast Cancer. So tell us a little bit about all of those books, if you like.
Well, it's actually my first book was how to help um, trainee consultants pass their final surgical exit exam, but not a lot of breast cancer patients want to buy that. So that's
To give to their breasts, to give to
I
their
know, I know.
consultant.
Hey, here you are. I bought I bought 10 books written by patients when I was diagnosed as a breast consultant surgeon because I didn't know what it was like to have chemo, what it was like to have tamoxifen. And I started tweeting with an amazing woman who got me through my statistics bit of my exam, and she bought another 10 books. She's a professor. We thought, God, if we're both clueless and we're experts, what are patients doing? So that was basically our guide from diagnosis to death, questions to ask, how to cope, what to expect, money, work, sex, health,
Wow.
mental health, talking to your family, all of that kind of a go-to guide that I wish I'd had when I was diagnosed. And it's still helping people even now. And I
Well, we'll put
hate,
the link in the show notes. We'll put
yeah,
the link for people to see.
and again, the menopause and what happens and how to cope. And I hate that people need my books because I wish breast cancer didn't exist. The second book is my memoir about what it's like to train to be a surgeon. So a bit like the Adam Kay casualty kind of stuff as a woman in a man's world, and then end up on the other side being having cancer. It is funny, it will make you laugh and cry.
Oh,
But I
brilliant.
got that published, crowdfunding it through Instagram. And Instagram has grown a lot over the last couple of years, and there's a lot of misinformation, what I call nutribolics. And I saw a video by the Happy Pair, two Irish vegan brothers, who had a podcast where a doctor said mushrooms can prevent cancer. And I said, this is nonsense. And I did a really angry reel, which went viral in Ireland. But then HarperCollins contacted me and said, we're looking for someone to do a common sense health women's cancer information book. And that led me down this route of trying to explain to people what cancer is, what causes it, what doesn't, why it's treated, why we don't treat it with magic diets, how to spot all the red flags on social media, what makes it come back, what won't stop it coming back. A bit like the apple cider vinegar documentary, people
Oh,
say that sugar causes
yes.
cancer and bras are dangerous and detox can do it. And they flood you with pseudoscience. And I have a million followers and I have a fake testimonial from an AI chatbot. And we've forgotten how to step back and think and research. Because I'm sure you've done this. I've dressed up to go to like a boots counter wanting a bag of Chanel freebies I'm never going to use. My little moisturizer serum that goes on every weekend away. And by the time I open it, it's out of date. And then I think I'm going to look like the supermodel. Well, I'm not because I'm a
Yes.
junior doctor doing 100-hour weeks eating shit. We want a quick, easy fix
Yes.
because the sensible things like exercising and eating well and maintaining a healthy weight are boring. You don't make money from them. But it was just my way of trying to help people make the right choice.
That is amazing. I love it. And is the imagery like a place on a map? Is that
Yes,
your?
it is. It's like because I thought, oh my goodness, that's COVID, but it's like a red teardrop, like how yeah,
Yeah,
Google
yeah.
Map where
You
you pin
put
a
drop a
point.
pin on a
Yeah,
map. Yeah, that
yeah,
is
and it's
amazing.
I use the word chocolate and Scrabble letters and explain risk. It's really, really simple for anyone to understand who's curious, who's going through it, who's scared. Yeah, it was a real labor of love because I could have written an encyclopedia on the 200 or 300 different cancer myths out there. It's crazy.
And that's the frightening thing, isn't it? I don't
Yeah.
think any of us are immune to. There is a dark side to all that marketing. I mean,
People are making a lot of money.
it
And the thing
is
is,
exactly that, Liz.
I could make a supplement in a factory in Eastern Europe for 50 cents and I could sell it for 50 quid and I could say this is bollocks and does nothing. That is how easy it is to make a supplement.
Yeah, it's not. It's unregulated, isn't it? It's
Yeah,
unregulated.
it's
It doesn't.
unregulated.
Yeah, and having worked in the pharmaceutical industry myself, I know the hoops that we have to go through, and rightly
It's
so,
crazy.
to bring
So
products
there's
to market.
a study showed that a third of supplements sold on Amazon don't actually contain the active ingredient.
Yeah, there you
They don't
go.
have to by law.
No.
And the gummies are the worst because they're like a sweet. They are even less
Shh.
regulated than supplements.
Exactly. And we always say to people during our sessions, please don't buy anything related to hormones on the internet, on the web.
Yeah.
Please just steer clear.
You can't balance your hormones. Your body does it.
Yes.
That's the latest thing, hormone balancing. Where does that come
It's
from?
clever, isn't it? It's all these,
Very.
as we know, technology is always listening, and then it's just flooding your algorithm with all of this sort of stuff. And so actually, I think we need to maybe retreat somewhat from the availability of information, and like you say, go and do our own research. Old
I think that's
school.
it. Double check. So I tell double check cancer information on CRUK because they pay people to go through the evidence. If you've got a
It's good
question about
advice.
menopause, then which website would you send someone to double check a menopause fact? Would you go to the British Menopause Society? Where would you? And I'd love to know where you would send them. So you can say, okay, I've seen it on TikTok. Let me go here and check.
Yeah, we always say so. Our go-to places are the Women's Health Concern. They do
Yeah,
amazing because they are the patient arm of the British Menopause Society. So the British
yeah,
Menopause Society. I'm a member of the International Menopause Society, European Menopause and Andropause Society. I think they
yeah,
are becoming much, much better at putting patient information. So wherever you are, because we do have an international audience, wherever you are, I think your menopause societies are the places where they are holding all that information,
yeah.
that research. But I think charities that really absolutely know what they're doing. And I would also say be careful of places that are supported. When we see influencers, touting the latest product with their
Yeah,
code that they're offering you,
I
you
know.
know, how much research has been done on, behind the scenes. I mean, I
Nothing.
don't promote things unless I actually have gone and done that
Yeah.
myself.
But I would
But
say there are some charities that are set up by influencers because
yes,
anyone can open. It's the same in there's a charity called Breast Cancer UK, which is basically saying get rid of all the plastics and toxins in your house and makeups dangerous. So I would say go to a society first where you know it is paid. They're not trying to get money off anybody. Go there
agreed.
first and ask before you spend your money.
Agreed, and that's why I mean there's some great fact sheets actually about breast cancer, about prevalence,
Yeah.
about what your options are.
HRT
So
is a great drug. Sorry, I'm talking over you. I'll do that again. You do
no,
your bit now.
no,
Sorry.
carry on.
I get so excited.
We're excited.
HRT is a fantastic drug for women who need it for the first 5 or 10 years. But after that, the risk of breast cancer does start to go up. Women
Yeah.
should not be on it until they're 80 or 90.
No. And we do need to talk about lifestyle because obviously, caning the bottle of wine every week or whatever, or every night, we know that there are prevalence data attached to that as well. I mean, you emphasize the importance of lifestyle and managing symptoms, but can you elaborate? Like if we were to sort of give a triangular sort of pillar of health, the
Yeah.
sort of things that people should be leaning into, what would you say they were?
So I'm going to tell you why, first of all.
Yes,
When
please.
you reach the menopause, when you get older, your bones start to weaken and crumble. And most girls didn't do a lot of exercise in their 20s, 30s, 40s, which is where we all should have started. And the worry is you'll start to shrink like my mum did. You get that
Yes.
dowager hump. So it
Yes.
is really, really important that you look after your body
Yes.
and your heart health because most women with breast cancer die of heart disease and strokes. That's what women tend to die of.
Right.
So you need to
Interesting.
think, right, what can I do now to delay the inevitable, to keep me strong and healthy? And the biggest reason women go into nursing homes is because they cannot stand up from a chair because they don't have the strength in their legs. So It's boring and it's not sexy, but it's exercise. Weight bearing exercise for your bones. Walking, you do a bit of a sprint walk to a lamppost and you slow down again, but getting a bit out of puff. You
Yes.
don't need to be in a gym, but you can do squats when the kettle's boiling or on the toilet. I do squats on the toilet, waving my arms in the air for the lymphedema risk.
Yeah.
Lunges, push-ups against the kitchen counter, body weight exercise to keep your bones strong and your muscles strong so you'll be a better, fitter person. The problem with the menopause is that most women's metabolism slows down. You get a mummy tummy that can stay, and it's much, much harder to shift that, and life isn't fair. So, looking at your diet and having protein with every meal, 30 grams of protein with every meal, which will help keep you full. It'll help slow down that weight loss. And if you do a little bit of weightlifting at home, that can help reduce the weight. There's no safe limit of alcohol. It's great now. There are so many different alcohol-free options available. It's not all
Mm,
Diet Coke. It
no.
does cause cancer, increases the risk of heart disease and heart attacks and strokes. So have a glass or two at the weekend if you enjoy it, but don't make it a regular thing.
Yes, I love all of that. And I definitely am that person who's leaning into, I can really tell my metabolism has slowed, and calorie restriction isn't enough. It is
No,
just
it's not.
simple equation. You just got to start moving more.
And things
And
like when you're taking the washing upstairs, you do it knicker by knicker. So you're going up and down the stairs 20 times a day, and that's you getting your exercise in.
yes,
If you don't have the time to go for a walk, you can actually do stuff around the house. It's thinking, and actually you're doing this for you.
yeah, absolutely. Have you seen the Netflix series, The Blue Zones?
Yes, I have.
Yeah, and so this is really like it's not rocket science. If you want to, we've got the evidence that shows people who live to 100, they're doing elements of these things, nine key things that they're doing. And it's like most things. I mean, I've only just started going back to the gym. I'm going this afternoon. My muscles are aching like hell from being at the gym on Monday, but I'm still going because you know why? If I don't, I'm just going to sit here in my office doing stuff. Sitting is the new smoking, isn't it? In terms of how it affects our health and our well-being. So I
Oh, I
think you're right.
know.
It's not sexy, it's not exciting, but it is just the facts of it that we've got to take a look at those things. I suppose if we want to leave people with an empowering message, because we do want to leave people with an
We
empowering
do.
message. Okay. And you're right. It's what I was hearing is education, being informed, thinking about where you're getting that information from is really powerful and what you can actually do for yourself before cancer or menopause shows up. That's what I'm hearing. You can do all of this
Yeah.
stuff before this stuff shows up. You've aimed to empower people through your books and your podcast. Tell people what your podcast is called, by the way.
So the podcast is called So Now I've Got Breast Cancer. Currently trying to get money from sponsorship to carry on with the next season, but it's aimed at anyone in the first year of diagnosis, talking to experts just to help them understand what's happening to them and why.
Yeah, absolutely. If you could give one empowering message for people to take away from everything you've learnt, and for people who are going into menopause when we know that, it gets all a bit hairy and things like diagnosis, not just for cancer, but also things like neurodivergence. We see a lot of changes happening around this time. What could you leave us with, or things to leave us with
Oh,
that would empower people?
I've got a million things running through my head, but I'm going to go with a book written by an author I love called Sarah Knight, which is Calm the F star CK Down.
Okay.
There is one question to rule them all. Can I control it? Stop worrying about things that you can't control and save your precious time, energy, and money on things you can. You do not know how bad your menopause is going to be. You do not know what you're going to feel like tomorrow, but what you can do is do things to get you through the day by
Yes.
exercising, by eating well, by eating chocolate, by dancing in the kitchen, who knows? But I cannot control whether my cancer comes back. I can do things to reduce that risk, but it's out of my control. So stop worrying about it and focus on what I can.
That is amazing. Thank you. I've just nothing to add to that. That is absolutely fantastic.
Nailed
So we'll
it.
put the link to Sarah Knight's book in there too. How can people know more about you, Liz? Where can they go to consume more of you?
So the best way to go is my website, which is liz.o'riordan.co.uk, and that's got links to my Instagram, YouTube, X, I keep saying Twitter channels, my videos, my books. It's all on my website. That's the easiest way to find out more about me.
Lovely. And what's coming up for you in the future? Tell us, tease us up with it. What
Oh,
exciting things have you got
so
coming up?
I'm speaking at two festivals. I'm speaking at Carfest, Chris Evans Festival, and then the Every Woman Festival in Cardiff, which is fantastic, aimed at girls, teenagers, women, all about women's health.
Is that Dr. Julie
I
Cornish?
Yes, she's a star. I'm an ambassador for it. It's a great, great, great event.
It's a
I'm running a
great charity.
workshop
It's
on
it's
what
a
to eat. Yeah.
great festival. I've got a number of friends. Womenkind Collective, Ginty and Lou, I
Yes, oh, they're
believe, will be there.
great.
Diane
Yeah, yeah.
Dancerbrink is going to be there.
Yes.
So
Yeah.
you are amongst like pillars of greatness, all of you.
Yeah.
So that's wonderful. So you've got that coming up. Anything else that you're looking forward to this year?
So I'm actually going to turn my dad. My dad came up with an origin story for a unicorn when mum was dying, and I'm going to turn that into a children's book, try something different. And I want to write a book about how to kill people on a train.
I
I write a
love
lot of
that.
murder
That's
mysteries. I'm trying
suitably
to,
dark.
yes, let's try something a bit different for a while. But seriously, I'm going all in on YouTube because all the videos on Instagram, it's hard to find them, and YouTube is
Yes,
a really good library of evergreen
definitely.
content. So that's what I'm focusing on now, just doing more videos to explain, to help people know they're not alone.
Brilliant. Well, you would be welcome back on this podcast anytime, Liz. Thank you so much for giving me your time. What a fabulous guest to have had. So thank you very much, and we hope to see you again. And good luck with everything that you're doing this year.